All right, let's talk about hormone therapy. Formerly called HRT or menopause therapy, now often called PET therapy for progesterone, estrogen, and testosterone. And we got it renamed that because when people say hormone therapy, they tend to just think estrogen and they don't realize that there's lots of different options and lots of different types. So PET therapy is actually a nice way to say there's lots of different options and seeing an expert who can help you. But let's break it down into two main groups: systemic hormone therapy and local or vaginal hormone therapy. So local or vaginal hormone therapy is incredibly low dose. It's basically like skincare. You're just helping the vulva, the clitoris, and the vagina be restored to its healthy state where it had hormones to function well. So minimal hormones. Almost anybody can take local vaginal hormone therapy, even our breast cancer survivors. If you go on the internet, American College of Obstetrics and Gynecology has a position statement free online talking about the safety of vaginal estrogen, even in breast cancer survivors. So it is indeed the very rare individual that cannot take local vaginal hormone therapy. Local vaginal hormone therapy tends to be estrogen, most commonly estradiol. That is the body identical or bioidentical. It's exactly what your ovaries make. And it tends to be the cheapest. Estradiol is generic in America. You can get a tube of vaginal estrogen for about $14 if you know where to look. So two types of local hormone therapy is estradiol and also the DHEA. The DHEA can come in a prescription, which is a little like vaginal suppository. It's got coconut oil and palm oil in it. And that's daily in the vagina. And it's very lubricating. And again, it converts to estradiol and testosterone, really helping pain with penetration, dryness, and sexual function. So that brand name is called Progesterone or Intra-Rosa in America. That is a prescription, as it is in most countries. Also, the vaginal estradiol is a prescription in America, over the counter in the UK and many other countries, because it's incredibly safe. One of the big concerns, and one of the things I'm a passionate advocate about, is removing the boxed warning on vaginal estrogen. So you all know those pieces of paper that come with any prescription. After the Women's Health Initiative, there was a boxed warning put on by the FDA that said vaginal estrogen therapy, again, remember, skincare, isn't going into your bloodstream. If I took your labs, I wouldn't know you were on this stuff. It's so low dose. But the boxed warning says it's going to cause blood clots, heart disease, it's bad for your liver, and it's going to cause probable dementia. Not possible dementia, probable dementia. Every single one of those statements is inaccurate. And we know, even if a woman is lucky enough to get a prescription for local low-dose estradiol therapy, 30% will not use the product because of the fear of the incorrect boxed warning. So currently, as of this recording, we are working with the FDA to correct truth in government labeling in this country, and the boxed warning on the vaginal estrogen products is inaccurate. It's not based in any science, it's incredibly safe, and we need to have the warning match the actual data. So we're working on that. This is a box of vaginal estradiol, and I'm going to show you how to use it. So in these boxes is the tube of vaginal estrogen cream and an applicator. Now, some people hate this applicator, and if you don't like it, throw it away. That's perfectly fine. But what you'll see is this applicator has different numbers on it. And the normal dose is not the 1. So this is 1 gram. So you can see it's about this much of product. So if you don't want to use this, tip of your finger to your first knuckle is about 1 gram, depending upon how big your hands are. But first knuckle or second knuckle is about 1 gram. So what you're going to do is you're going to open your tube of vaginal estradiol, and it's just a white cream. And you're going to put this on here, and you're going to fill it until that goes to the number 1. So that is 1 gram to the 1 mark. And then you can put this in the vagina and deposit it. The other thing I really like to do with vaginal estrogen cream, and the reason why I like the cream more than the tabs or the suppositories, is you can actually put it on your finger, and you're going to want to put it on the clitoris, and you can also put it on your labia minora. Remember how the labia minora go away with low hormones. So this is literally like eye cream. You're gonna put eye cream and you're gonna put it on the labia minora and you can wipe it around the clitoris. This is skincare. Skincare for down there. Also that 6 o'clock spot, which is really gets tender and thin for a lot of people, great place to rub it in. And don't just slap it on and put on your pants. You wanna rub it in, I say, like you're in Texas in August on a hot day and you're putting on sunscreen. Like let it absorb in and work. So that's why I like the cream. Not only can you put it in the vagina to help with elasticity, is you can actually put it on the vulvar structures to help with moisture and good collagen, good blood flow on the sexual structures. Some people, off-label, they can put a little bit of this, I'm not joking, on the crow's feet. So to be clear, local low-dose vaginal estrogen, or DHEA, is to treat vaginal atrophy, or more commonly the term now is genital urinary syndrome of menopause. You don't use this as a sexual lubricant. You use it literally as skincare for low hormone states. A common question people will ask is, do I have to keep using it in order for it to work? Yes, absolutely. Remember, when hormones go low after menopause, they don't come back. Unless you get an ovary transplant, nobody's doing that. So hormones will stay low. You have to keep using the product, just like sunscreen and seatbelts. You have to keep using the product in order for it to work. So very common standard is to use it twice a week, just as a maintenance dose. Here's the other amazing thing about local low-dose vaginal estrogen. It decreases the risk of recurrent urinary tract infections by 50 to 60%. In addition, it helps treat overactive bladder, urinary urgency, frequency, and getting up at night to urinate. It is literally helping the pelvis have healthy hormones again and just replacing the hormones that used to be there when the pelvis worked more functionally. So to be clear, local pelvic hormone therapy is different than systemic hormone therapy. Systemic means full body. If I measured your blood, I can see that you're taking a hormone product because it's actually in your system. It goes to your bones, it goes to your brain, it protects your heart. Systemic hormone therapy. A common question is, can you be on systemic hormone therapy and vaginal hormone therapy at the same time? Absolutely. It's basic math. So vaginal hormone therapy increases your blood level by 0. And if systemic hormone therapy increases your blood level by X, it's a simple math problem. X plus 0 equals 0. So yes, absolutely, you can be on both. About 30% of women who are on systemic hormone therapy also need or want to be on pelvic hormone therapy. So I, for just show and tell, have some simple options for systemic therapy, but by no means is this all inclusive of everything that there is. So systemic hormone therapy, or PET therapy, usually consists of 3 hormones: progesterone, estrogen, and testosterone. This is an estrogen patch, most commonly used twice a week. Again, systemic hormone therapy. So this delivers a constant low dose of estradiol to your system. It is FDA approved for vasomotor symptoms of menopause and the prevention of osteoporosis. So this twice a week patch is a teeny tiny little patch, most oftenly put on the upper buttock or above the groin, and just swapped out twice a week. Progesterone is the other type of systemic hormone therapy, most commonly given in the body-identical form of micronized oral progesterone. This is the powerhouse for sleeping. So often you'll take it an hour or 2 before bed. If you're taking systemic estradiol therapy and you have a uterus, you must be on progesterone. The common thing you get asked is, if I've had a hysterectomy, can I still take progesterone? Yes, absolutely. And finally, the black sheep, but not to be forgotten, is testosterone. All bodies make testosterone. Women just make 10 to 20 times less than men do. But we make more testosterone than estrogen in our body. We actually can't make estrogen in our body without first making testosterone through something called the cholesterol pathway. So we start with cholesterol, through that make testosterone, via testosterone make estradiol. And all of the testosterone doesn't just convert to estradiol, that's the other myth. We actually keep a lot of our testosterone around and our whole body uses it. Testosterone slowly goes down after our 20s, so we have about 50% of our testosterone in our 40s and 50s as we did in our 20s. This is prescription testosterone therapy. This is a full tube of what a man would use in 1 day. In America, we do not have an FDA-approved testosterone product for women. So women must compound a cream, microdose a man's dose, or use a pellet. Pellets tend to be the highest dose, the most expensive, and the most invasive. Again, if we're lucky and we have long lives, we're going to live about 40 years post-menopause. We want to have something that's cost-effective. Insurance often won't cover testosterone products because we do not have an FDA-approved product yet, but it is coming. And when it comes, the whole conversation is going to explode. But in the meantime, let me show you how to microdose a male product. So this is testosterone gel, 1%. Again, this is what a man would use for 1 day. And a woman needs to use 1/10 this product. So you can either estimate it and kind of understand when 10 days are and make it last 10 days. Or if you can buy, and you can get this on Amazon, you buy a 5 cc syringe, put all of this in the syringe, and then use a 0.5 cc syringe a day. That's 10 doses in the syringe. So testosterone will come, when it comes in male products, it'll come with a tube with a cap, or it'll come in a packet, kind of like a ketchup packet. The ketchup packet's tough to dose for over 10 days because it doesn't have this airtight seal and the product can actually degrade by touching the air. So we do like the Testum tubes with the caps, but they can tend to be a little more expensive. So you open up the tube, and the tip of the cap is what you do to puncture the tube just to open up the product. And now this is a gel. And this gel, ideally, I'm not going to show it to you because I don't want to get naked, but you're going to do about a pea-sized amount, like that, and you're going to do it most commonly lateral thigh. And just rub it in until it dissolves in. We'll just go right here because I don't want to waste the product. But it absorbs pretty quickly, and then wash your hands. You can, with any gender, you can transfer your testosterone product to small animals or small children. So wash your hands and put it in an area where you wear clothes. So this is once a day. Make this last about 10 days, and that's a female dose. Other best practices for female dose testosterone include checking labs to get a baseline testosterone, and then rechecking in about 6 to 8 weeks to make sure that you're absorbing and that you're at a good range therapeutically. It's very rare to get too high of a dose when you microdose a male product. We see really high dose testosterone a lot more commonly with the pellets. Side effects of too much testosterone would be androgenic side effects. So hair loss where you don't want it, hair growth where you don't want it. Really high dose can lead to voice changes and clitoral enlargement. But again, experts who know what they're doing, who simply treat to a therapeutic female dose, rarely have high testosterone dose symptoms. Here's the thing, doctors don't have a lot of time. I'm one, I get to pick on them a little bit. We have at best about 10 minutes with you in the healthcare system of America currently. So know what you want and know why you want it. It's very helpful if you say, I'm not sleeping well and I'm having severe hot flashes. It is significantly affecting my quality of life. I know that estradiol is FDA approved for hot flashes and prevention of osteoporosis. I would like to try it. And here's the thing, doctors love follow-up. Can I try vaginal estrogen for 3 months and I will make a follow-up appointment and we will adjust or change as needed? Doctors love that. They love knowing they're part of a team, that you're going to follow up, that they're going to adjust as needed. And when you get a win with this, share the win, because that is the way that the doctor says it helped her, it might help the next person too.